Ordering multi-phase plans. Multi-phase plans are built for patients who are undergoing a procedure or an operation. You may hear folks refer to them as umbrella order sets. We like to think of these kind of order sets as an umbrella that hold many order sets within that umbrella. When I click on that Add button, and I'm going to type in, we have a test multi-phase plan order set here for us to look at, and I'm going to say Done. I want to draw your attention to the Orders View pane. So here is our test multi-phase plan, and then within that plan there are sections for PAT, sections for pre-op, sections for PACU, and sections for post-operative care for this patient. If I'm the physician and my patient is going for surgery, once they're registered, I can come into the patient's record and I can begin planning their care. The PAT section is typically going to be completed by the PAT nurse following PAT guidelines. There will be a PAT section also for the physician, and let's say that that is this. So if in addition to any PAT guidelined orders, I additionally want a CBC placed for my patient when they get there, I would go ahead and place a check mark in that order set. Preoperatively, I'm going to address the things that are in the preoperative surgeon order sets. Again, there will be an anesthesia preoperative care and a surgeon preoperative care. But I can begin to plan my care now. I do want them to have sequentials. I do want them to have a pre-op antibiotic. And I do want an x-ray of their knee before they go into surgery. At this point, the patient has not arrived at the hospital yet, and I want to leave these orders in that planned state. I don't want to actually initiate the orders. So this is going to be a bit different than placing PowerPlans. Typically for PowerPlans, it was a 3-step process to get the orders into a signed state. It is the same way here, but right now I don't want those orders initiated. I just want them to remain planned. But I did make some changes in these order sets. So I'm going to go back to the PAT order set, and down here the button does say Sign, and when I sign that, it's essentially processing the orders that I added to that, and you'll see it change to Planned. Here as well, it kept the orders that I had checkmarked, and it changed that order status to Planned. This way I can begin planning my care for my patient. When they arrive in PAT, PAT will open up the order set that's there, and if there isn't an order set that's already planned by the surgeon, PAT will open up the generic plan that's built for that procedure or that operation, and they will place the orders that are checkmarked and begin care that way. Preoperatively, when your patient arrives for surgery for that day, the preoperative orders again will be initiated by the nurses in the holding areas. Arrives in the preoperative area, in the holding room. The preoperative nurse is going to highlight the preoperative plan. She's going to see those orders that you've added. She then is going to initiate the orders, and she is going to add the details that are missing. The consent is going to come off of your orders that are faxed from your office. Here. Then I come down to the bottom and I do the second part of my 3-step process, which is orders for signature, which again compresses my order sets and shows me only the things that were checkmarked. And I sign. And again my screen goes blank and it asks me to refresh my screen. And when I process, and refresh that screen, you'll see that these orders are initiated, and you'll see that my preoperative section of this multi-phase plan has now been initiated. Once my patient now has been through their procedure and enters the recovery room, the PACU order sets will be opened. The physician postoperatively will finish adding any orders that are appropriate at that time. Medication orders and labs. Again, to initiate and sign these orders is a three-step process. I see that there are a couple of orders that require some details. So I'm going to work my way down and complete all the details. And then I'm going to do orders for signature, review my orders one last time, and sign them. I'm almost done, but I do need to go back to the preoperative orders and make sure that those orders get canceled now. Those were preoperative orders and no longer apply to the care of my patient at this time. So I'm going to highlight the preoperative order set, and I'm going to right-click on it, and I'm going to say discontinue. It's going to bring me up a list of those orders that were in the preoperative order set, and what I will do then is look through these orders and check mark the items that I do not want to discontinue. So the check marks here, as you can see, are keep items. I do want to keep my patient on sequential compression devices. I don't need to keep the consent order, I don't need to keep this piggyback order, and I don't need, my x-ray is already completed. So I'm going to say OK, and when I do orders for signature now, you'll see these three orders that I'm discontinuing, and I'm going to sign those. And when I refresh my screen now, you'll see that my preoperative order set is discontinued and only my PACU orders are initiated. And that's how we will work through our care. Once the patient is in PACU, the surgeon can go in and begin to plan the postoperative care if the patient is going to remain an inpatient in the hospital overnight. And at this point the patient's in PACU and you know they're going to be admitted, so we can go ahead and initiate these orders now. So I'm going to do orders for signature as my second step and sign as my third step. Now at this point I have two order sets that are initiated, and until my patient completes their PACU stay, I'll want to keep the PACU orders initiated as well. But once they leave the PACU and they're going to the floor, then we can discontinue the PACU order sets that remain active.